Thank you all. It's a great pleasure to welcome you to a roundtable at the end of this 2022 RRI Conference. And the topic I would like to discuss with you, what are themes, topics you feel very passionate about, you think should be covered in the 2023 RRI Conference? I really would want to pick your brains here, and I'm very much looking forward to this discussion. I am Peter Kotanko. I'm a nephrologist and head of the Renal Research Institute in New York, and I'd like my guests at this roundtable to introduce themselves. Maybe start with you, Maria.
Okay. Hi, everyone. Thank you for the invitation. My name is Maria Ferris. I'm a pediatric nephrologist, and I'm a professor at the University of North Carolina, Chapel Hill. And I focused in adolescents and young adults with chronic disease.
Thank you so much, Maria. And let's move on to Amaka.
Hi, everybody. Thank you for this invitation. My name is Amaka Eneanya, trained as a nephrologist and clinical researcher. Now am the head of strategy and operations for the Global Medical Office at Fresenius. So thank you for having me.
Thank you, Amaka, for being with us. And Jeroen?
Thank you very much, Peter, dear all. My name is Jeroen Kooman. I'm also a clinical nephrologist from Maastricht University in the Netherlands. I've been so since 1998. I'm also a professor of nephrology at Maastricht University, and I really like the combination in my work of doing clinic research and education. And my field of education has been more in complications of renal dialysis therapies and complications of renal failure themselves. And we do a lot of collaboration with Renal Research Institute.
Yeah, thank you, Jeroen, and thank you all for your introduction here. So now that we have attended the 2022 conference, we kind of know what kind of topics were discussed. For example, there were topics around optimizing solute transport or about home hemodialysis. There were other topics dealt with novel use cases for peritoneal dialysis or molecular insights into arteriovenous fistula maturation and development, and other topics dealt with artificial intelligence in kidney care and the use of wearables. So in the past, over the years, we have, the RRI Conference had a sort of mixture between, let's call them avant-garde topics. So these are topics that discuss themes that may be at the horizon or on occasion even beyond the horizon, and very hands-on topics. So I'd be interested really to learn from you, and maybe we start with Maria. What kind of themes, of topics would you like to see discussed in the 2023 RRI Conference?
Well, thanks for getting me started, and I'll try to be brief. There are so many interesting new changes that are happening with the artificial intelligence, availability of long data registries. I would certainly like to see a little bit more information about minorities, particularly being Mexican, about Hispanics and the Hispanic paradox. Why is it that Hispanics have lower end-stage kidney mortality than some of the white patients? Is it because they go back to their country of origin at the time of death? Is it because they have better health? Are they younger immigrants that come through? I would like to have that explored a little bit further. Secondly, I would like to see topics about new therapies, such as cell therapies and therapies available to halt disease progression once the disease is already present. And certainly, I would like to explore the survival and optimization of adolescents and young adults with chronic and end-stage kidney disease, because as we know, they have greater survival than adults. But how can we optimize their care and help them with disease self-management and with life issues?
Thank you so much, Maria, for sharing these thoughts with you. And maybe So I certainly have taken note of those, and maybe we move on to Amaka. So what would you like to see discussed, and then Jeroen, and then let's go through through these proposals and see what the group thinks about it in greater detail. Amaka, please.
Yeah, so thank you so much. So when I was a researcher in academia prior to coming to Fresenius, a lot of my work focused on patient-reported outcomes such as quality of life, decision-making, shared decision-making, even end-of-life care. And I think it's important to make sure that we capture the patient's voice in research and look at a variety of patient-reported outcomes. So whether that be new therapies used to treat uremia and how, what happens to their livelihood, or looking at advanced care planning, for instance, palliative care outcomes. I think these are very important and honestly done a lot outside of the United States. And so I would love to see that more in the United States. Also, I would agree with Maria, focusing on healthcare disparities, racial disparities in particular. We know that Black, Hispanic, Native American patients tend to have higher prevalences of kidney disease, progress more quickly to needing dialysis. And so really focusing on, we know the epidemiology, I think we can move past that, but really starting to think about the factors that contribute to the epidemiology, the disproportionate epidemiology, such as the effects of structural racism, looking at food insecurity, looking at housing insecurity, looking at different types of heat differences based on neighborhoods. And we know that there's neighborhood segregation, so that affects these populations. So looking at a variety of those outcomes, I think would be important. So I'll pause there.
Yeah, no, thank you, Amaka. These are wonderful suggestions and certainly to be considered. Jeroen, what are your thoughts?
Yeah, thank you, Peter. I think one of the very interesting challenges is the way how we are going to personalize therapy more in the future without increasing complexity. That's because that's, I think, really a challenge. It's difficult. It has been found actually to individualize dialysis therapy just in a very busy dialysis clinic, and attempts to do so by providing different types of therapies or different type of dialysis solutions. At least in my experience, has been found to be difficult in a way because it's more complex for the nursing team and sometimes also for the physician. So that's one. And on the other hand, I think that what would be interesting is to look at the ecological impact of dialysis in the future, because it's not at this moment a very ecological therapy, at present. We throw away a lot of rejection water by reverse osmosis. It's an energy intensive treatment. And it would be interesting to see how, let's say, in 2030, we would prescribe dialysis or perform dialysis in a way which has less of an ecological footprint. I think that would also be interesting to see if there are already possibilities at present which, let's say, we could, together with our hospital boards, employ.
Yeah, thank you, Jeroen. So, I mean, it's really interesting listening to your proposals, because when I think back over, say, 3 years, 5 years, 10 years at the RRI Conference, and don't forget, next year will be the 25th RRI Conference. So, in the past, the conference was much more focused on technologies, was much more focused on aspects of biology and chemistry and so on and so forth. So I think there is what I'm hearing from you. You would want the conference to be way more focused, say, on the societal consequences and that lead eventually to CKD, and also on the impact of dialysis on the greater society and on disparities that we all observe and are very much aware of. I think it's also really interesting that the topic of advanced care planning, palliative care, was brought up. So, but I'd like just to throw this out here for those who have, say, what do you guys think about this whole question of specifically kids and young adults in minorities and the care for them? Is this a topic that you would want to see discussed? And I'm specifically asking here Amaka and Jeroen, and because the proposal came really from Maria's end.
Please, Amaka.
I definitely think it's important. Full disclosure, I haven't treated a pediatric patient since medical school, but it's always something that I find important. When I was a treating clinician, transitioning to care was a very difficult time. I feel for pediatric patients, that transitional period between being a child and being an adult. And I don't necessarily feel like I was very well versed in some of the therapies, for instance, that they were receiving, and then what I had to do with them to transition them going forward. So I think it's definitely important that we include them and their patient-reported outcomes, right? Like, what does that mean for them? What does transplant mean for them? I think that's a big topic that we should focus on. Mm-hmm. Is transplant not only in the pediatric population, but in the adult population. So I absolutely think they should be included in this research. And I think your question was whether we should focus even more on minority, racial and ethnic minority pediatric patients. Is that the question, Peter? Mm-hmm. Definitely. Absolutely. I think that's important as we move forward in trying to prevent this disease. The younger that these patients are, and we know that they're disadvantaged in multiple ways. So their voices and their perspectives are incredibly important to include.
Yeah, well, what about undocumented patients, both adults and children? Do you feel that this is an area that should be discussed in greater depth?
Yes, I definitely do. Yeah. I wrote an editorial on a study that was looking at emergency dialysis and what happens to patients, undocumented patients on dialysis once they become scheduled, what happened to their quality of life outcomes. It was a mixed methods research study that was focused on interviews as well as a number of surveys, and they did better. And I think that as more and more states adopt policies that move away from emergency dialysis for undocumented patients and start to cover, have the insurance plans cover those patients, it's extremely important to include them in the research agenda.
Yeah. Thank you. And Jeroen, I mean, you work in Europe, in the Netherlands. So, what is your take on these suggested topics?
I think it's very relevant, and let's say from a European perspective, it would be very relevant to include, let's say, patients from refugees countries. Actually, it's not so much, I think, of let's say, the payment is not so much of a problem. I must say, for instance, in the Netherlands, so that's not really the issue. But let's say more the transition of people who come from a refugee situation and having a chronic disease. I think that's really challenging, both in terms of let's say language, how to communicate together with them, how to let's say how to get them well, let's say give them the same chances as let's say as Dutch patients with regard to transplant chances to really to let's say to integrate them let's say flawlessly into the healthcare system. I think that's an important challenge, and also they're looking at their quality of life. How can we improve that? And with let's say with often traumatic backgrounds, I think this has become very acute, obviously, in Europe recently.
Yeah. No, thank you for bringing up this the topic of refugees, and I know, of course, from European colleagues that quite a number of challenges have arisen from the most recent refugee crisis due to the war in the Ukraine. So this seems to me a topic that we all agree that should be certainly covered in the 2023 RRI Conference. Are there any other aspects beyond the ones we have discussed so far in the realm of, say, societal aspects of kidney care.
Yeah, maybe it's just also, if I look at the position in the Netherlands, it's also a lot of social economic disparity. It's not only racial, but it's also social economic disparity, as you see. And I think it's very interesting example comes not from the Netherlands, but from Glasgow, where you have extreme differences in just overall survival between West Glasgow and East Glasgow, which amounts to approximately 30 years, which is incredibly high. But also, for instance, in the Netherlands, and I'm sure in all of kinds of different countries, you have within countries or even within regions large differences in health outcomes, which also affect, of course, the risk of kidney disease, but also the risk of adverse outcomes. And I think that's also very interesting to look at. How can we prevent this? How can we how can we best treat these challenges?
I wanted to think about disparities as well as regions. For example, the Mesoamerican nephropathy, which is not just in Central America, but Mesoamerica, which also includes Mexico and parts of South America. Those are topics that are emerging and interesting. And then in terms of disparities, even within the COVID-19 pandemic, our experience with telemedicine and how telemedicine services have been utilized differently and having access differently by minorities compared to people with more affluent income, i.e., people who do telephone consults rather than telemedicines because broadband coverage is not in their plan or not available in their region. So COVID-19 has opened a lot of doors for telemedicine and telehealth services across the world, but for example, comparing the experience of countries who have done this all the time, for example, Ontario network telemedicine in Canada and other countries that are used to doing telemedicine way ahead of us, right? And now some of us in the US and other countries who sort of did something very quickly as the pandemic progressed.
I think that's very interesting, and it also brings up the issue of digital literacy. Yeah? Not, let's say, of course, you have the technical issues, lack of broadband, but also you have, especially in times that we don't see our patients sufficiently, and to actually think that they might be well reachable by new technologies. It also means that we have to have attention for digital literacy and information literacy in our patients, and to make sure that no patients are left behind. Certainly in, let's say, with new developments of healthcare apps and in which we actually think that everyone is involved in that, but that's not necessarily the case. There's always a group who will be left behind.
Right.
And with, let's say, all the enthusiasm with which we have for digital technology, I think that's really something we have to take into account, because there might be forgotten group.
Right.
Absolutely agree with everything that's been said, especially the literacy piece. I think that's key, because like you just said, a lot of people may have access, but they need someone to give them a little bit more upfront guidance and education about how to use it, or otherwise it's just there's no use to them. In terms of other societal effects, I really think that when we're thinking about disparities, we talk about structural barriers that are in place, whether that be income, education, access to health insurance. I also think we need to focus on discrimination, racial and ethnic discrimination, gender discrimination. Now, there's a lot of research that's focused on sexual orientation and that type of discrimination, because that's there. And nobody likes to talk about it because it's uncomfortable. Nobody thinks that they're discriminatory, but we know that there's more and more studies that have looked at implicit and explicit bias and show that patients are definitely negatively affected when it comes to their outcomes when they're discriminated against. And so now there's a number of tools that we can use to measure discrimination. And I think that will only lead to interventions that will hold people accountable and to start to decrease discrimination, whether it be in any area of the world.
Yeah, no, thank you. I mean, these are excellent suggestions, and certainly something that we'll propose to the program committee to think in greater depth around it, and to make sure that they are covered. And yeah, those who have attended the RRI conference over the years, they know that we positively to not shy away from controversial topics. To the contrary, and one of the highlights of many RRI conferences in the past were actually debates, and there were Maria, I think you and Jeroen, you have attended a number of RRI conferences in the past. There were some outstanding debates about really burning topics, and so I'm just wondering, what kind of debate could you envision at the conference around this field of themes we just discussed? What would be a topic for a debate here?
That's an interesting one.
Or is there nothing to be debated because people by large agree on the topic?
Please,
I can think of a pediatric topic. So the use of ACE inhibitors and ARBs in patients who have congenital anomalies of kidney in the urinary tract for delay or halting the progression of disease. Mm-hmm. But that's very pediatric centric.
Mm-hmm. Okay.
So this would apply, I think, you already mentioned that, cost of care is different depending on where you are in the world. But I think specific to the United States, cost of care is something that has to be considered. And I think a debate would be where to actually put resources, whether that's more upstream interventions versus downstream, whether that be devices or some type of multidisciplinary approach to improve care delivery. Yeah. That costs money. Yeah. And so I think that would be a good debate.
Okay.
Yeah, also thinking a little bit about that. Maybe it's an interesting debate. Of course, we want to improve dialysis therapy to the limit. On the other hand, we also have to be as inclusive as possible, and we also know that some people are left behind, or either implicitly. So a debate might be: what do we do? Do we try to attempt to make the most physiological dialysis treatment possible, which we know costs money? Or, on the other hand, should we actually focus on just having an acceptable dialysis treatment, which is as inclusive as possible?
So a debate would be acceptable versus best dialytic therapy.
Yeah, and that's assuming we have limited resources, which we have.
Yeah. Well, we have. I mean, we are all operating, of course, in the climate of limited resources. I mean, what you said is that some are left behind. Actually, when you think globally about the problem, I guess we all know that the rate at which the patients that would need kidney replacement therapy grows faster than the rate at which we're able to deliver it, meaning that the gap between those who would need kidney replacement therapy and those who actually receive it is getting wider and wider and wider every year. And to me, at least, this is one of the I almost say widely unnoticed catastrophes of our days, that we are just as societies and maybe also the nephrological community industry is not able to deliver the appropriate care to those patients. I'm wondering if this would be a topic for a debate, what to do about this care gap that's globally evolving.
Interesting, yes.
Okay, good. Now, then other aspects of the RRI conference are traditionally keynote lectures. So these are lectures really on topics that are brought by profound experts in the field. And I'm wondering, what are your thoughts about potential topics for keynote lectures?
I would like to learn more about artificial intelligence in I would want to bring an expert to see how AI can truly help with the future of healthcare.
Okay. Yeah. Yeah. Other
I would
thoughts? Yeah.
I would I would like to know more about transplant. I think the payment models, especially in the United States, are moving towards incentivizing towards payment towards transplant, and so the countries that are doing this better, I would like to hear what are some lessons learned. Right? I've heard recently that, for instance, some countries, organ donors, that's a default thing for the general population, whereas that's something that has to be decided here in the United States. So I would want to hear something along the lines of transplant, whether that be an allocation system or how people are doing it in the best way.
Yeah. So it would be an overview of, for example, internationally the organ procurement and allocation systems, right? So something along these lines. Yeah, and obviously there is major differences between the countries and sometimes within the country. Yeah. Okay. Okay. Thank you, Amaka. Jeroen, what do you think?
Yeah, I might think that it would be interesting to have an attention for climate change and nephrology, and also for climate change in dialysis prescription. And there's maybe some interesting aspect to that. Patients treated in dialysis units which are not air conditioned when it's very warm, what does it do to their treatment tolerability? And I know you've also done quite some work on that, Peter, in the Renal Research Institute. And also this might also bring up, I think, the role of climate change in the risk of renal diseases, dehydration together with, let's say, these pathophysiological factors which Maria mentioned bring in, let's say, the higher risk of renal failure in agricultural communities. And I think that would be relevant to take as a broad, let's say, to take it as a broad approach. Role of climate change in nephrology, dialysis tolerability, etc., etc.
Yeah. Yeah. Okay. No, that's a very interesting theme, of course. Would you also think about the integrating in such a keynote lecture the contribution of kidney replacement therapy, dialysis primarily,
Yes and no. It's interesting to raise awareness for that, as I said at the beginning. But we also have to, and of course, dialysis is not a very ecological treatment, and it's good to pay attention to that. But it's in the end, it's probably not being a major risk, let's say, major contributor to climate change per se. I think I would like to have there could be some attention to that, but the keynote lecture more focusing really on the broad lines. Yeah. We know we have climate change. What does it mean for our patients? What does it mean for the risk of renal disease? So it could be, of course, as a kind of a side note, but I would not make it a major focus of this talk.
Yeah, no,
important as it is.
No, I understand. Yeah. And I mean, the conference will go over 3 days, and actually we can have keynotes on every day. So I think the topics you brought up, I think is certainly something that the program committee will consider. Now, another aspect of the RRI conference has been a focus on novel and emerging technologies. What in your mind would be really cutting edge innovations that have either been recently introduced to the field of kidney replacement therapy or about to be introduced in the not too distant futures that you would want to see discussed?
At the risk of jumping ahead, but and at the risk of talking about an important topic that's important to Peter Kotanko, I would want to hear some update on allohemodialysis at the time. And it's not a keynote presentation, but I would like to hear the progress of your idea of allohemodialysis. Okay. And also, I would like to hear more about cell-based therapies and interventions.
Okay, good. Thank you. Thank you, Maria. Other thoughts, Amaka and Jeroen?
Yeah. So, I mean, I think COVID-19 is here with us for a long time. So, Paxlovid, I know that there's not been a lot of work looking at renal populations. I think the more we know, the better, especially as we think about potential surges that are coming. So, I think focused on COVID-19 therapies for patients with renal disease.
Okay, no, thank you. Thanks, Amaka. Jeroen.
But if you're talking about keynote and new technologies, but
No,
I would be interested.
just the broad theme of new technologies, not necessarily in the context of a keynote lecture.
Oh yes, no, but I would be interested in still the subject of physiological dialysis and how we could, let's say, for instance, with feedback technologies which have been around for quite a while, but they have received some new attention. I would be interested to see how we easily, with the new developments on the dialysis machine, could individualize the personalized therapy better.
Okay, no, thank you. These are really important suggestions. Now, the next question I would have, I mean, the dialysis community was, of course, severely affected by SARS-CoV-2 COVID-19 pandemic. And it has been a major topic, say, in the 2021 RRI Conference. I mean, almost the entire conference was dedicated to COVID-19, as you can imagine. What COVID-19 related topics would you like to see discussed? I've heard Paxlovid, yeah, and are there other COVID-19 related topics that you think would be important to discuss?
Maybe that if it has been an extremely challenging period, and with all challenging periods, we also learn a lot. So what I would say, to have a kind of resume, assuming that COVID is, as we hope, decreasing even more a little bit. Looking back on this period, what have we learned? What can we take away from it, which might have even something positive in the end? Talk about telemonitoring, talking about, let's say, I don't know, but let's see, what good did it? It brought us a lot of challenges. It was an extremely difficult period everywhere worldwide. But what can we take away from it? What we can use for it if we have another pandemic, if we are in another disaster situation? What should we do differently? And what should we do differently? Or what did we learn from that?
Mm-hmm. Yeah,
I would chime in and definitely build upon that to see the long-term effects of some of the AKI renal outcomes and long COVID. How has that affected our patient population? What does their prognosis look like? Who has progressed to CKD or even ESRD from COVID? I think there's still a lot that's unknown, but longitudinally, what has happened and what can we learn?
Mm-hmm. Yeah, thank you.
And it would be nice to have an international focus, meaning, what did the European countries learn and did versus the Latin American and North American countries and African countries. We will highlight disparities certainly, but were there changes in policies in the countries based on their experience? It would be nice to have a global focus, because this was a global pandemic.
Yeah, and no, thank you, Marie. And I believe there is one overarching theme would be lessons learned from through the pandemic that could be applied to potential future pandemics, and where the gaps were in our response, where the strengths and so on. So I think this would be certainly a very interesting topic. Okay, so I think we are coming towards the end. Are there any final thoughts from the group? And maybe I start with Amaka. So you have this whiteboard exercise. What would you want to put on this whiteboard for the 2023 conference that will take place in September 2023? that has not yet been discussed, or are there other points that you really want to reiterate, to reinforce, and to make sure that they are on the program?
Yeah, I mean, I've seen some interesting data looking at interest in nephrology and how, in the United States, at least, that seems to be declining. I'd want to know from the trainee perspective, internationally, what does that look like? What are some things that really attract people to the field, and how can we make sure that remains sustainable? So I would want to include some type of trainee opinion, whether that be dual trainee programs like critical care or palliative care in nephrology. But what does that look? What's the landscape of that internationally?
Mm-hmm. Okay, very interesting. Yeah, we haven't touched on this at all. I mean, we and some previous RRI conference we did, but not for a while. So this will be certainly a very interesting topic. Yeah, Maria, what
well, thank you for mentioning trainees. So, Amaka, you may not know this, but with the support of RRI, we had a Pediatric Nephrology Fellows Conference, International Fellows Conference, and we've had it for now, it'll be our 15th year. We started 10 years after the conference started. I actually would want to propose that it's the 25th anniversary of the conference. It would be nice to talk about, or maybe write about, what has happened with RRI's 25 years of experience. Perhaps even, and I'm happy to, I have the records of all the pediatric nephrology fellows that have attended, because they come in supported by RRI. 100 fellows a year or so are supported for this conference, and maybe grab the 25 years of experience and say, this is how many trainees have attended, this is what happened, and perhaps even query some of them. Mm-hmm. What did you learn? What did you network when you were at this conference? What was the outcome? How did it impact your career? And I'm very happy to help with that effort, but I would love to hear, being part of the audience, hey, we've been at this for 25 years. What is it? What are our outcomes?
Yeah, I have to say, I really love this idea. Just thinking back, I mean, over 2,000 nephrology fellows have attended, supported by RRI, the RRI conference over the years, and
from around the world.
Yeah, from I guess all over the world. I mean, certainly 50 plus countries, and it would be really interesting to get their feedback, what they their thoughts with the distance of a year, 5 years, 10 years, 15 years regarding the RRI conference. That's very interesting. Yeah. Mm-hmm. Okay, Jeroen.
Yeah, I think we have discussed a lot of very exciting and interesting topics. Just something which came to my mind. It's a little bit technical again, but that's dialysis in extreme situations. You don't encounter them often, but if you encounter them, you have to act. For instance, what do you do with dialysis with extreme hyponatremia? Dialysis in patients with hypo or hypothermia. How can we use these technologies actually to correct the internal environment? And this is a little bit more technical in a way, but it's also might be interesting also for fellows to know what to do in these types of rare circumstances, but you will encounter them once in your life. So it's but it's a little bit maybe off topic with the, let's say, broader things which we have been discussing during the panel discussion.
I don't think at all that it's off topic, because I mean, this is very practical. And as you said, people may encounter this. Now, when you said dialysis in extreme situations, I had to think of our colleagues in some of our Ukrainian dialysis facilities who would move the entire dialysis facility to the basement of the building and provide their dialysis 24/7. So this is another kind of extreme situation, and there might be learnings from that also. So I think if this is phrased a little bit broader, I think this could be actually very interesting. Yeah. Mm-hmm. Yeah. Okay. Now, hey, this was wonderful. I cannot tell you how much I enjoyed this conversation, and I've learned a lot, and I I'm most grateful for your suggestions for the 2023 conference. If I may, I will come back to you at some point in time, just if there are clarifying questions needed, and I will certainly keep you all updated on the development of the program, and I would love your feedback, because to me, over all these years, the RRI Conference has been such a joint endeavor between the Renal Research Institute and partners from dozens of academic institutions that would discuss in the program committees very passionate about topics. And I think this, again, was a great opportunity to learn from you what you would think that the 2023 conference should cover. So really, thank you all, and I wish you all the best and a good remainder of the day.
Thank you very much, Peter.
Thank you for having me.
Amaka Eneanya. Thank you.
Thank you so much.
Thank you, everyone.